Hello everyone, welcome back to this video series on clinical SAS programming. So one of the user has asked me to explain the difference between adverse event and clinical event. In this video, we will try to understand the difference by seeing some examples. So adverse event is basically defined as any untoward medical occurrence in a patient who is administered a pharmaceutical product. And SDTM IG defines clinical event as an event of interest that would not be classified as an AE. So where do we classify a particular event as an AE or not? It will be present in the studies protocol. So whether it is an event of interest or not would be specified in the protocol. If it's an event of interest and if it is not classified as an adverse event, then that information has to be captured as part of clinical event. Otherwise, it has to be captured in adverse events domain. So, so in most of the cases, clinical events of interest could be the symptoms of disease under study. So we will see some examples on what for these symptoms of disease under study. So I have listed here some of the untoward medical occurrences like diarrhea, headache, vomiting, seizures, pain at injection site, redness at injection site, and reduced glucose levels. So in terms of medical terminology, all of these are medical occurrences. So but whether it is event of interest, that would not be classified as an AE, or whether it has to be classified as AE would depend at the study level. Let's take the example of this diarrhea. Let's say a, we are trying to conduct a study which is used for evaluating different treatment options for diarrhea. So this is actually a symptom of interest, and this is will be if diarrhea is specified as an event of interest in the study. So this information would be reported in CE instead of AE. So again, because in that study, diarrhea is an event of interest and it is specified in the protocol as not an AE. So all the occurrences of diarrhea in that study would be reported in CE instead of AE. So let's say take the example of this second headache, and let's say this is headache is occurring in a study where we are trying to evaluate different medications for treatment of migraine. So in the migraine, so headache is a common symptom, and then if protocol clearly specifies that event of interest, a headache is an event of interest, that information would be reported in CE but not in AE. So on any other study, headache would be reported in AE, but in this specific study where we are evaluating treatments for migraine in which headache is a common symptom, so we report that information in CE domain. Similarly, let's take the example of vomiting. Let's say we are evaluating different chemotherapies in cancer studies. So, and it is a common symptom when the subject is undergoing chemotherapy in cancer treatment that they would experience vomiting. So again, if the protocol specifies it as an event of interest, all the instances of vomiting would be captured in CE domain but not in AE domain. And if it is not specified as an event of interest, so that information would be reported in AE but not in CE. So let's take the example of seizures. So let's say we are trying to evaluate some treatments for epilepsy, which is in which seizures is a symptom. So in this study, let's say if they want to keep track of number of occurrences of seizures, so it would be clearly specified as an event of interest in that study, and this cannot be called as an adverse event because it is an event of interest and it is a symptom of disease under study. So in that instances, seizures would be reported under clinical event but not as an adverse event. Similarly, let's say we are studying a vaccine study, so in which the vaccine is being administered using an injection. So pain and redness is common things when we give some injection. So these may not be adverse class called as an adverse event, and these could be events of interest in that studies wherein vaccines are being administered using injection. So in that cases, so pain and redness at the site of injection would be called as clinical events but not as adverse events. So similarly, let's say we are conducting a study for diabetes wherein insulin is being administered to the subjects to bring back their elevated glucose levels to normal. So one common thing is like when you are trying to evaluate treatments in diabetes, sometimes the blood glucose levels even may fall down below the normal levels, and this reduced glucose level or hypoglycemia would become an event of interest in such studies. So that will be captured in CE domain instead of AE domain. So again, if it is specified as an event of interest in the protocol, this information would be reported as CE. So all of these things are untoward medical occurrences, but the meaning of each of these untoward medical occurrences may vary from study to study. So we have seen examples of cases wherein diarrhea may become a clinical event but not an adverse event, and similarly for other things. So there is no hard rule that what is an adverse event or clinical event because it varies from study to study. So I have tried to summarize some examples where the information could become clinical event instead of adverse event. I hope this is helpful. Thank you for watching and keep learning.